Last week marked 2 years since the first COVID case was reported in North Carolina. This Saturday marks 2 years since Mecklenburg County reported its first case. Since then, we've ridden a pandemic roller coaster of shutdowns, mandates, and evolving science on the virus. As we look toward a life where we live alongside COVID, WCNC Charlotte's Vanessa Rufus verifies which facts have stood the test of time and which have not.
Do you remember the 3 W's?
We must all get used to the 3 W's. Wearing a face covering, waiting 6 feet apart from others, and washing our hands frequently.
It was a pandemic mantra in North Carolina, and we heard it every single day. 2 years, several COVID variants, and hundreds of millions of vaccinated Americans later. Do we still need to follow the 3 W's? We went to the CDC and infectious disease specialist with Novant Health, Dr. David Priest.
Pre-Omicron, we felt pretty good about masking, surgical masking, cloth masking, but N95s and KN95s are more effective if you're trying to avoid Omicron.
So the bottom line is yes, masking, hand washing, and social distancing are still important, but their standards have changed. Ventilation also proving to be just as important a factor as 6 feet of distance. All right, so now did you ever wipe down your groceries or vigorously clean every surface in your home or office? And do we still need to wipe everything down? The CDC says you should still disinfect high-touch surfaces and things an infected person has touched, but wiping everything down?
At some point, we started to call that hygiene theater. It makes people feel a little better. I certainly have seen that in businesses, and I understand why they do it. But in terms of the actual spread of COVID, that has not been a major issue.
So we can verify that no, you do not need to wipe everything down. And finally here, what about risk? You know, one of the first groups that we moved to protect in this pandemic were those 65 and older and people with pre-existing health conditions. So are those groups still the most at risk from the virus?
Still the same. I think those are folks just more vulnerable, and they don't respond to vaccine. You know, occasionally we have individuals who are hospitalized who've had 3 doses of vaccine. But they tend to be much older, often approaching 80 years old, have other health problems, and they frankly just don't respond to vaccine.
So yes, people 65 and older and those with pre-existing health conditions are still at a higher risk for catching COVID. But some good news, we have vaccines, treatments, and therapies to save lives, options that we didn't have at the start of the pandemic. Another concept that seems to have evolved, the idea that we're going to beat this virus by eliminating it. That seems to be replaced by the endemic concept, essentially keeping the virus in manageable but relatively stable levels and living with it. With your Verify, I'm Vanessa Rufus.